Ladies and gentlemen, 2023 kicks off with my buddy, Rob Packard. Rob, take it away.
Okay, I cannot see your screen at all. I don't know why.
Trust me, it's on slide 2.
Got it. I see it now. Thank you.
Uh-huh.
I got to figure out why Zoom doesn't do the same thing that I expected to. So, when you are going to prepare a submission to the FDA now, one of the things that is very different is you have a new template that the FDA would prefer that you use, and you have until October 1st to use this new template. After October 1st, you will have no choice. You will have to use the new E-Star templates. And what it basically is a PDF document where you attach everything where the template tells you to attach it and answer the questions. And then you just upload a PDF document that has all these attachments. And so therefore, every submission has the same format, has the same content, has the same sections, and that ensures that the FDA is dealing with much more consistent submission formats and contents. But it also makes it difficult for companies to use their own method of doing things. You no longer need a table of contents. You no longer need a cover sheet. You no longer need, in fact, even an executive summary. That's optional. The 510K summary is automatically generated for you if you wish. So the new templates really have the potential to save a lot of work for the FDA because they know exactly where everything is, exactly in the order it appears. But when it comes to software, what we find is companies believe that, oh, I have software that works, I can submit it to the FDA, and working and validating software are not the same thing. So this is the intent of this presentation, is to show you what is required to be in the submission as of today, but keep in mind that the FDA is also expected to update this template later this year with new cybersecurity and software requirements. So it is definitely a work in progress. This particular section is the beginning of the software section, and they have a section where they say, what is the level of concern of your software? And most people are used to providing a level of concern document that documents this for the FDA, but that's not what the FDA wants with this new template. They just want you to answer the questions by using the drop-down menus.
What does the concept level of concern mean? How vital it is to the operation?
Joe, I did a Google search on that because I was interested as well. And you know what I come up with? What? It's on Medical Devices Group Net, a document by Mr. Rob Packard.
You're saying that a Google search of this yields something on my site that Rob wrote?
Yes, that Rob wrote. And it says there are 11 different types of software validation documents. And the level of concern is a term that the FDA uses to categorize the risk of software as a medical device. There are 3 levels of concern: 1 minor, 2 moderate, 3 major. Is that right, Rob?
It is.
Okay.
And that's the minor is
it can't really cause any harm.
Search. I'm just so curious. This is the #1 answer on your Google search. It's not something on FDA. Luke?
Well, no, the first one is something of the Jonah Institute, but the second one is WW Medical Devices Group Net question. What is level of concern? LOC.
All right.
How about that?
How about
we
that?
get a featured snippet.
Yes.
Or at least ranking #2.
Yes.
So a lot of companies, they're wondering what minor is and moderate and major. And it really is very simple. If any of the first set of questions here are answered yes, then it is major. If any of the second set of questions are answered yes, then it is moderate. If none of the questions in the first page or the second page are yes, then it is minor. And you can see from these, this would be something like an AED or a defibrillator of some kind, or a ventilator, something serious where it has either a lot of power and it could kill you, or it's going to bring you back to life. Does that make sense?
It does.
Okay, next page. Here are the second set of questions. And once again, if any of these questions are yes, then it becomes moderate. If none of the questions are yes, then it is minor. And they just want you to enter in the blank here that it's minor, moderate, or major. And I believe the PDF is validated, so it automatically populates based on what your answers are.
Is it fair to assume that the from minor to moderate, from moderate to, what is it, severe, urgent? What's the high one?
It's major.
Major. That there are more fields that you'll need to fill in and more documentation you'll have to provide?
Absolutely. For those people out there that are familiar with the standards for software validation, there is an IEC 62304 standard, and that standard has classifications that are A, B, and C. There are very, very few 510K devices that are considered Class A, but that's the lowest risk of software according to that standard, and that correlates loosely with minor. But you're going to find very few products that fall into that category, because if it does any diagnostic function or any treatment function, it's probably going to be moderate. So a good example of something that would be minor would be something that is going to allow you to visualize something only. So that's the only thing it allows you to do, is see an image on a screen. Doesn't do any measurements, doesn't do any treatment, doesn't do any diagnostic. It just allows you to see something. But as soon as it starts taking measurements to help you with diagnosing, it jumps up in risk. Most devices fall into the moderate category, which is Class B of software for IEC 62304, and a few will fall into the C, things like defibrillators, artificial hearts, pacemakers, ventilator. Those are the things that fall in that category. And it could be parts of your software. So maybe only one part of your software falls in that category instead of all of it. Now I think we can go to that next slide. So this is where you attach your documents. Most companies say, well, I have software as a medical device. I already provided a device description. Why do I need to also provide a software description? Well, there are different levels of detail. One is focusing on what the functions of the software are and what it treats, what the indication for use are, what the patient population is, what the use environment is. Is it a mobile app? Is it on the web? Whereas the software description is going to talk much more about the design of the software. What language is it in? What operating system is it in? What algorithm you've used? How did you create the algorithm? It is possible, if you have software as a medical device, you could have one that meets both requirements. But what the FDA really wants is one section that's the device description section, where you provide a description of your device, in another section, this section, where you provide a detailed description of the software and how it's built, what the inputs and outputs of the software are. So that's your first attachment. If you're outsourcing your software development and you can't describe what you want in detail, it's really hard for a developer to give you a quote because they don't know what you want. So a good way to think of this is this is the scope of work that you're going to give your software development team. This is what the software should do. This is what it should look like. This is what the screens need to look like. You're going to give a description of the software, and it's going to be very detailed. The more detailed it is, the better the development team will be able to hit what you're trying to get them to make. And that
how long do you recommend people that just the description part be?
In general, I expect to see something that's somewhere around 5 to 10 pages.
Mm-hmm.
And if you have 20 screens to your software, you should have a lot more pages in your software description. If you have 5 screens in your software, 5 to 10 pages might work just fine. So it has a lot to do with how complex your software is. And if you're doing a submission that has multiple formats of software, like we have a Mac version, we have an Android version, we have a Google Chrome version, every single one of those is separate. So you might have a separate software description for each platform. You could combine them all into one, but that just gives you more pages in one document. Does that make that clear?
Yep, thank you. It's just one of my favorite questions when I get people who.
Yeah,
have
that
software.
there is very
They're-
much a mentality of, does it weigh enough?
Yeah.
If-
Well, they're like, I'm like, where are your software documents? Like, what are you talking about? It's
Yep.
software. And I'm like,
So to put it in a good frame of reference, I know a company that produced a 6,000 page 510K submission for software as a medical device, and it was a mobile app. So.
Wow. That's gonna be my new benchmark. I'm like,
Yeah, that is my benchmark. 6,000 pages.
unless you have at least 2,000 pages, then you need to go and do some work and come back.
Yeah, a good way to think of it is anything less than 30 pages average per section is probably not enough. So yeah, you could get by with 10 pages for one document, but your hazard analysis, the example in the guidance document is 6 pages. The traceability matrix could be 1,000 lines long. So yeah, I have seen software documentation that's as short as 100 pages, but I've also seen it 6,000 pages. So the right number of zeros is probably 100 or more pages for the software section. But as soon as you add test reports and they want the full test report, you could have 100 different software requirements, and each one of those is several pages long. That's how you get hundreds to thousands of pages. It's how many software requirements do you have? So you shouldn't have a software requirement that fills up less than a page. You could, but it's a pretty thin requirement if it doesn't fill up a page. Your architecture design chart is another thing that you need to have that shows the different modules of the software. That's going to be a flow diagram that shows the flow of information from one part of the software to the other. It's going to show the inputs of the software and the outputs of the software data-wise. It's going to show what's in the cloud and what's hosted on a device, what gets communicated. That architecture design chart, the simpler that is, the shorter your software section is. The more complex that architecture design chart is, the more complex your software section will be. But if you have a minor level of concern software, you're not even required to provide an architecture design chart because it's probably just one module or maybe 2 or 3, but something really simple. Whereas if you have a class B software that is moderate level of concern, you expect many multiple sections to the software, modules to the software, and each module has its own requirements and own place box on the design chart. So
Jeff, you look as though you had something you wanted to add.
I think I made that face when you said 1 page per software requirement. I thought you meant that your software requirement specification, your SRS, should never be less than 1 page, which I completely agree with. Usually, each single requirement.
Each single requirement I would expect to be a paragraph or more. So you might have 2 or 3 on a page if they're thin, but if they're very detailed requirements that help you design your unit testing, your integration testing, a really well-written software requirement spec would be a page. And so if you have hundreds of software requirements, you have hundreds of pages for an SRS.
I usually do less. Usually it's maybe I just break down my software requirements more. It's usually it's basically a long sentence. It's kind of how, and I use the easy requirement syntax, which I don't know, someone Verna, and I can't remember the other guy's name, came on a long time ago and presented, and I loved it when I saw it. So I typically use that.
Okay.
But
so
anyway,
when you do that, then you end up putting more detail in your software design specification. And you probably have more software requirements than somebody that has very simple requirements.
I would just say that I guess my requirements are probably more granular than the ones you see. Certainly the difference, like requirements to design things, the types of things that go in those 2 documents are very separate. So I wouldn't think there's a lot of difference there, but I would imagine my requirements are more granular than the ones you're looking at.
That's a good differentiator. Is some companies will write very high level SRS requirements that are more like, what does this function do? And then other companies will have every step the software has is a requirement. And that's the granular approach that you're describing. It's not that one is right or wrong. It's how detailed are you going to make it, and how much traceability are you going to have. The more granular you are, the more traceability you have, the easier it is to debug, but the longer your documentation becomes.
Sure.
You also know what you're doing, Jeff.
Yeah,
And that is not the general gist of things that.
no, most people are like, what's an SRS?
Yeah.
If I were going to write a blog, that would be the kind of title, like, what is an SRS? Whereas
Right.
This question is like, how detailed does my SRS need to be and how many pages should it be? That's a more detailed question that requires understanding what is an SRS first. Going back one to the device hazard analysis, a lot of companies come to me and say, we don't have any hazards. You can't cause any harm with our software. And the FDA always disagrees. And what I start with is, well, do you have any potential for mix-up of data, loss of data, corruption of data, loss of communication, cybersecurity? Those are all possibilities that could be risks or hazards associated with your software. So what we recommend is that you go to purchase the IEC TR 8002-1 and skip ahead to the tables that actually give you examples of software hazards. Because there's 6 pages of software hazards. And so when somebody
What's that
gives me
document again?
5,
Say the document name again?
yeah, it's IEC TR 8002. I'm sorry, there are 3 zeros, 80002-1.
Boy, you guys are nerds. Jeff is like, yeah, that's right, 3 zeros. Go on.
So you buy that standard, you go to that table, and you start with that as your starting point, and you say which ones of those categories of hazards apply to your device, which ones don't, and you got to apply those hazards to every single SRS, depending on how granular, of course, you are. So the more granular you are, the fewer they're going to apply to each requirement. The less granular you are, the more hazards that will apply to each requirement.
Rains, I see you've come off mute. Did you have something you wanted to add?
I was going to chime in when we were talking about length and granularity of SRS requirements, but I think I was in general agreement once it cleared up, how granular you're going to get affecting the length. I found that true. So
Thank you.
So if you are a company that doesn't have a software development team and you're going to outsource the software development, you need to hire a company that knows 62304, which is the standard for software lifecycle management. And they need to be given a software description of what you want. You need to give them an architecture diagram, like I want it on this kind of platform and I want it to communicate with this system and I want it to have these functions. And you need to be able to provide, if possible, a software requirement spec, because those are all the functions at traceability level that you want to have. But I find that's where we have most companies fail. They can write a description, maybe they can write an architecture diagram, but they don't know how to identify hazards and they don't know how to write an SRS. So if you're at that level, you really need to learn a little bit more so you can give the software development team that you're going to hire enough detail that they can properly write the SRS for you and do the hazard analysis for you. And that should be the point at which you agree on the scope of the project and you set them loose. If you don't agree on the SRS and you don't agree on the hazards and you don't have a finalized software description and an architecture diagram, you're really having them develop a proof of concept for you that's a prototype rather than a finished product. Or you're giving them a blank check to go ahead and spend your money. So I highly recommend, if you're outsourcing this, you really want to have those 4 documents nailed down in your statement of work, and anything that you do up until that point that those 4 documents are signed off on, think of that as more scoping study for the development team.
Jeff?
And I would just say that I find that that's typically a very collaborative process. No one who is at the level where they're designing the system of a medical device typically understands how to write software requirements well. And so I and any competent software development team, like there's lots of sometimes painful meetings, but I drag requirements out of them kicking and screaming. And
Yeah.
I'm the one who spots the inconsistency and say, okay, these 2 contradict. Which one would you like to do? I would think you would want to do this, but let's hash it out together.
Yep.
That's often a bit of a long process,
It is quite painful,
but worth it.
Jeff, since you're not here regularly, some of the folks on the call might not know your specialty. So an invitation to plug, what is it you do?
So I do embedded software development for medical devices. So I typically focus on lower complexity, simpler devices, such as surgical tools, patient monitors. You're not going to find me as part of a large team working on an MRI machine. I'm a solo developer, and I essentially do all of this that Rob is talking about. I do that for you.
And would that be on firmware primarily, or would you say firmware and software?
Firmware primarily. I am not an app developer. So yeah, it's embedded software on the device.
So that's a good indication, because a lot of people think of firmware as, oh, that isn't software, it's firmware. And like, no. The FDA considers that to be software too. It's just software on your hardware embedded in the system that doesn't have a graphic user interface. Whereas software in the general term is it's got some sort of interface and a display. And then we have a whole lot of things that are apps that are somebody has a cell phone, or they have a desktop application, or they even have viewers. Sometimes you'll even have an output that's manual, like a piece of paper, or an image in a PAC system or something like that. So we see the entire range, but with the world of no coding software and the ability to create AI algorithms in a weekend, we're finding that people can come up with what they call software in almost no time at all. But just because it does what you wanted it to do doesn't mean it's a device or something that we could ever put in front of the FDA. You've got a proof of concept. That's sort of like the difference between, I have a tube that I can stick in your arm. We're not going to call that a catheter. It's got a long ways to go before it's a catheter. It might have multiple lumens. It might have a tip. It might have a control feature. It might be in sterile packaging. There's a whole lot of things that you got to figure out before you can call it a catheter. And software, it can be infinitely more complex. And then when you bring in firmware as well, the sections of the software documentation are software, cybersecurity, and interoperability. So every single device that has wireless communication, any single device that has the ability to store data or upload data or download data by a USB or an SD card, anything that's going to have a wired connection through an Ethernet port or an RS-232 port, those are all going to be things that have cybersecurity vulnerabilities. And then you have to design your device, your software, to be secure in addition to working the way you want it to do it. So you have security requirements as well as functional requirements, as well as safety requirements. And so that now the FDA is saying, oh, it's not enough to have it validated. We want you to have a cybersecurity plan, and we want you to show us the test reports from that plan. And that's where it's all going to change, where instead of providing 11 documents for software, each of those places where we showed on the slide where we attach here, add attachment, all those blue boxes are just for software. They're going to have a similar set for cybersecurity when this new guidance comes out. Please attach your boundary analysis. Please attach your vulnerability report. Please attach your pen testing. So they're going to actually ask for those test reports. Right now, they're only asking you to attach your cybersecurity plan post-market. So what are you going to do after you launch the product to make sure your software remains secure? Instead, they're going to shift gears to show us the testing that you've already tested it to make sure it's secure. And, oh, by the way, we want the credentials for the person that did the testing, and they have to be independent of your team. So that's just like an auditor. They have to be a qualified software developer that knows how to do penetration testing, and they have to provide evidence of their testing. And they can't be on your development team. They could be in your company, but they can't be on your team. So you got to be big enough to either have a whole separate team that does pen testing, or you have to hire an outside firm at who knows what price tag.
Thank you, Rob. Hey, you mentioned cybersecurity, a quick interstitial. Those who came to 10X last year remember Vidya from MedCrypt, and we talked with Shelby. We were going to put together a panel on cybersecurity for the April event. So if you have some ideas about areas of particular interest, please let me know. Also, I have a down payment to the facility this week. So any MDG member who registers between now and a week from today, I'm giving you a $500 discount. So reach me directly. It'll help me cover my very big expense. Thank you in advance. And Maureen, you have your hand raised.
Thank you. Back when we were talking requirements, I just wanted to mention that what I have seen with some clients is they will do the initial set of requirements and they're done. This process, and Jeff is smiling, process of developing the requirements, which use the hazard analysis for very extensively and identify those risks, like the ones Rob was talking about with cybersecurity, is sometimes where you have to educate clients that that discussion is ongoing pretty through the entire software development cycle. So sometimes the approach is here's your requirements, I'm going to throw it over the wall and forget it. And that doesn't work very well if you're a company that's asking someone to develop your software.
Can we go back to that the slide that had all the blue boxes?
Of course.
That was my exact question, is if we, because I was very interested in your presentation. How far were we digressing from it, or were we done with it?
There we go. You can see it again.
Yep. So the first 4 boxes are the things that I would recommend the company have as inputs into the development process, and a good developer will make sure that you have those agreed upon before they go start writing code. They should be coming to you with, here's our design specifications for how we're going to do this to meet each SRS requirement. But you've got to also agree on who's going to have the procedures for software development. That right below the traceability analysis matrix, there's a requirement for the software development environment, lifecycle process description. That's your procedure for software development. And one of the things that the FDA looks at very carefully in that particular document is how you're going to control updates and patches to your software. That's what they're most concerned about. But you could say, we use agile process for development, we're programming in Python or C++ or whatever it is. And this is how we're controlling patches and updates. It could be very high level, it could be very detailed, but whatever the process is, you've got to attach that procedure to this 510K, and they're going to refer to it, and they're going to expect whatever documents are referenced in that procedure are included in the submission. So if you include a whole bunch of templates in there and a whole bunch of documents that are required outputs of your software development, but you aren't attaching those same documents in the 510K, there's a disconnect. So if you're using your developer's procedures, then you want to attach their procedure there. If you're using your own procedure, your developer needs to agree that that's part of the scope of work. They're going to follow your procedure. So that's an important thing that should also be upfront in the project. Whose procedures are we using? What templates are we using? What I see a lot of developers that have never done software development for medical devices do, they will have one big document that's about 1,000 pages long that covers all of these sections. That's not going to work, because you can see I need to have all these different attachments. And if I try to attach the same document twice, the system won't let me. So I have to have a separate document for every attachment, or more than one attachment.
Maren, before we move to the next slide, did you have one more comment?
I did have a comment because I often see companies will create like separate QMS processes for software change management versus other change management. One of the things about 62304 in general is that you don't have to create new processes for everything under 62304, like change management or monitoring in the field. You can use your existing change management procedures, your existing complaint procedures, and all of that. So just because it's asking for a software process here doesn't mean you can't use your general processes.
Agreed. But you do have to attach whatever the process is. Agreed.
Yeah, but you can use a general one. It doesn't have to be specific.
The verification validation testing should be, it depends on whether you have a minor, moderate, or major level of risk. But for the major level of risk, they really are going to want to see all the testing. For the moderate, they're going to allow you to summarize your testing and you can get away with very minimal summaries that are at a very high level for the minor level of concern. But they have different levels of detail they want. Some of the best documentation I've seen is where you have columns where you show, here were all the tests that we had to do. Here was the unit testing results, first pass. Here was the results of the second pass, third pass, and maybe by the fourth pass, everything passed. And then when you get to the integration testing, you have, once again, iterative testing, and you show what the yield is from each sequence through all the integration tests. And then you have your system testing. So you're going to have V&V testing that you're going to be providing quite a bit of documentation for, but it can't be a summary, but you're going to have something you can show the FDA for what testing was done, what are the outputs, and they're going to want to know what version of the software was tested, because if you tested an older version than the one you're submitting for, they're going to want to know, how did you address those gaps? Did you do some kind of regression testing to show that this minor change didn't matter? Or did you redo all your testing for the latest version? The things that you could probably leave to the very end of the process are the unresolved anomalies. Are probably the last thing you want to do, because these are just your bug report, any bugs that you didn't fix. And any bugs you didn't fix, the FDA is going to have questions about. So you want that list to be really short. Your revision history is the revision that you finally submit to the FDA. It could be a one-page document. So that's something you can create very close to the very end. But the traceability analysis matrix, that's going to have to be one of the latest documents you create right before revision history and unresolved anomalies, because you need to provide traceability to all your V&V testing, all the SRS items, all the SDS items, all your hazards have to be cross-referenced in that matrix. And the FDA literally goes line by line through that traceability matrix for every single thing that they think could cause any kind of harm.
David?
So Rob, sorry.
Go ahead, Martin.
I might modify that a little bit and say that the traceability analysis matrix is one of the last that you will finalize. But you actually want to start creating it very early in the process and have that ongoing draft.
Yep. Yeah, just like an FMEA document, you would typically work left to right in the matrix, and you would fill in the hazard column first, then the SRS column, then the SDS column. So you can do it over time and finalize it at the end. But for companies that have never done this before and they're relying on an outsourced partner, the traceability, the final draft of your traceability matrix should be near the end, but it would be nice to see them working on it and filling in the columns as they go.
David?
Yeah, thank you. Rob and others, when I was using the version 2.1 of the eStar for this section, the company that we were working with had some technical documentation plans and reports that needed to be used in a couple of different of these sections. And we noticed you could only upload it once, so we had to change the name, and then upload it so we could have it uploaded again in the section that had.
Yeah, and they don't like that, but that is a workaround.
Yeah. Okay. Thank you. That's it. Yeah.
Another way to do it would be use Adobe Acrobat and split it up into sub-documents, but once again, they don't like that. They prefer to see a complete document for each section. So it's good to know that up front. These are my deliverables. If you're going to write a scope of work for a software developer, make sure those are your list of deliverables.
Yeah, from that eStar perspective, it was mainly they wanted it to match with the quality system, so we didn't want to create subcomponents of things. So we just if you're auditing a supplier that you're considering to hire, you might want to look at their procedure on software development and see if it matches that template. If it doesn't, maybe they're not the best choice of a supplier for you. I know of vendors that do nothing but software documentation for 510Ks and de novos, and they have script that automatically writes the sections of the documents for you or for them. So they always have everything that they're supposed to have in the documents, and it's all written exactly the way the FDA wants it. But not everybody works that way.
Rob, in the interest of time, I'm going to advance to the next slide.
Sure.
And I think you can see that now, yes? Recognize standards?
Nope, no. I'm not seeing that page. I got to figure out why I cannot see.
Are others?
I see it.
Okay. Well, page 5 is IEC 62304, et cetera, and AMI.
I got it.
Yeah.
So for those people that were trying to remember what that big long number was, the first item there is the life cycle management standard that the FDA recognizes. And you can get that through EVS.EE, which is an Estonian standards organization. It'll be very inexpensive and it has everything you need and it's the latest and greatest. That's what we purchased and that's what I would recommend. The second one you will only get through AAMI inexpensively, and that's if you're a member of AAMI. So that's where I would buy that one from. And as I said, that's where you can find tables of listing hazards by category for software. And it has a very long list of them and gives you examples. It's titled, hazard analysis for software. And it references the 14971 standard, but it makes it very clear that this is how you apply 14971 to software. And one of the fundamental issues the FDA has is that for software and human factors, they don't want you to use the probability of occurrence to estimate risk. They only want you to use the severity of the hazard. And so that's why this particular standard, I think, is really powerful. It has in there a fault tree diagram as the recommended output format for your hazard analysis. So you could just have a big long table of hazards that goes in your traceability matrix. But if you're going to actually use your hazard analysis for something useful, like complaint investigations, or trying to debug your software when you have problems, a fault tree would be the useful tool that you'd want to have. So when you're doing that 8002-1 standard, you want to be thinking about, I need to learn how to do a fault tree diagram. And it's one thing to list all the faults and all the hazards. It's another to put it in a useful format, which would be a fault tree diagram. And you can make that quantitative over time and show what the probability of occurrence is, but only through post-market surveillance of your software and testing. You're not going to just be able to guess what it is like you could with more mechanical failures.
Michelle, did you want to add something?
Oh, I just had a question for Rob. I had a client try to tell me that they were already well into their product development and ISO certifications because they have product marketed elsewhere and we're helping them with their US stuff. But they're trying to tell me that, oh yeah, they're really close to having their TIR 8002 certification. And I'm like, I've never heard of.
So 8002-2 is the standard for software used to manage a quality system. And yes, there is one company that offers certification in it, but I was told that the backlog is 6 months and it's not worth the paper that it's written on.
That's what I thought. It's kind of like
not worth the paper it's written on.
Yeah, you can get 14971 certification too, but it's marketing. The FDA could care less what things you have certified. They don't require any certification of any kind. I guess an exception would be they want you to have FCC certification for wireless components. They want you to have electrical safety certification, but quality system certification, they could care less.
Okay.
And there's an example of the fault tree. So if you've seen those kind of diagrams before, they date back to the 60s in the Minuteman program. And so if you want a good guidance on how to do a fault tree, go download the free documents from the Minuteman program in the 60s. And they will tell you how to properly do this. Back when things were made with leaded solder and wires. Here's the guidance document that is for software today. This is the final version. It's 23 pages long. It tells you what should be contained in each of those documents that is an attachment with a blue box. So this is what you should be reading, but there's a 2021 draft guidance that was released last year, and they're expecting it's on the A list for final versions to be released this year. So we expect a brand new software guidance document to be released this year that will supersede this 2005 outdated version.
How great are the changes?
Say that again?
How great are the changes?
Significant. They're changing the terminology from level of concern to we want basic and enhanced documentation. So 2 levels instead of 3. And the level, the complexity of the documentation is getting bigger, and they're getting a little bit more prescriptive about how they want you to do the development. So that'll be a learning curve for everybody. But I'm much more concerned about the cybersecurity document that's also supposed to be released with that. That is a lot longer and has testing requirements, whereas the software, there's not any new testing requirements. They've just changed the documentation a little bit. Whereas the cybersecurity, they actually want you to provide test reports. So that means more attachments in a longer section. And that should be, you might have one more guidance after this. Okay, so there's the draft guidance that I was talking about, the 2021 guidance. That's the draft. So if you want to know what's coming, you could read this. It's only 39 pages, but you could also just wait until the final version comes out and then catch up. And then one more slide, I think.
Actually, you have 3 more.
Okay. So if you are developing software, almost everybody is using off-the-shelf software, either as an operating system or a library. Jeff, you might be the exception, developing firmware and embedded systems. You might not need off-the-shelf libraries, so you can write your own. But for anybody that's doing something that's not an embedded system, that's more of software rather than firmware, you're going to have off-the-shelf software. And operating systems be a great example of that. And they want a complete list of all the off-the-shelf software. They want you to do a risk assessment of that software. They want you to do at least black box validation of that software. And it should be on your software bill of materials, which is part of the new cybersecurity labeling requirements.
Jeff?
And I was just going to apologize to the group. I have to run. I wish I could stay, but I'm recording my podcast in 5 minutes, so I got to jump off.
Tell us about your
Good luck with
podcast.
The Agile Embedded Podcast.
Cool.
Look it up.
Yesterday.
So we're actually doing a crossover episode with Embedded FM. So anyone who's in the embedded space has probably heard of Alicia White. So we'll be talking with her.
Be sure to share a link with the group.
Will do. Take care, guys.
Thanks,
Bye.
Jeff.
Thank you. This one here is the principles of software validation. So it's basically a tutorial on how the FDA sees you doing software validation. You could model your software development environment and lifecycle management procedure around this, but this is a 2002 guidance document, and most people aren't even familiar that this even still exists, and it has a lot of overlap with the 2005 guidance. So I find this is good for general understanding of software validation for somebody that is at the level of what is software validation, but not terribly helpful to the person that actually does this work. And this slide here is just supposed to have a screen capture of the cybersecurity section. Yeah, there's the cybersecurity section, and that's going to be my next one of my webinars coming up, talking about the cybersecurity documentation. But that's a whole nother section, and then interoperability of the software is another section. And those
you'll share a link
kind of go
with us.
together.
You'll share a link with us.
Those are a whole 510K series. I basically am sharing this software section with the group, but the cybersecurity section is going to be on a different day, and so I wasn't planning on sharing that with the group. But if
what I mean is, you'll share a link for February 9th so folks can join you.
yes, I can do that, but that's not on cybersecurity. Go back a slide.
Yeah.
Okay, so that particular one is that's going to be only the people that have bought our course.
Okay.
We have 2 other webinars the same day. One of them has to do with EU post-market surveillance, and one has to do with US post-market surveillance. So I'm doing 3 webinars in one day. This one will be private to people that have bought the course.
How much is the course and what does it cover?
The course right now until February 1st is $1,195. It covers all of our weekly webinars for the eStar template and gives you all of our templates and all the historical webinars that we've done, over 40 of them.
Oh, wow, okay. Thank you.
Yeah.
And let's see, here we go. It's the 510K course. Let's see what happens when I click on that. Well, I'm curious. I like your very sophisticated
Yeah.
animation.
Yeah, I go old school.
It looks as though you're holding a sign, but it's really
It is a tablet. So I've got right here. It's how I keep all my handwritten notes organized. It's a remarkable tablet.
Do you like it?
I love it. And every single employee that has one loves them.
Okay.
Well,
Yeah,
thank you.
for those of you that still handwrite notes, it's a saver.
Do you, I know you are going to be joining us at 10X, thanks. And I know you're planning to present, but I don't know what we decided on, if anything.
I
we?
wanted to talk with Michelle about that to see
Okay.
if she wanted to collaborate on something or not.
Okay, fair enough.
Sure. Let's talk next week.
Okay.
We have Alyssa's friend, George Cramp. He's going to talk about how to improve patient selection and adherence. Karen Deepus the following week, common mistakes to avoid in your QMS. And fan favorite Rick Stockton returns on January 27th to talk about design for manufacturability. And a couple folks are lined up for February as well. So if you do want to be on the agenda, just shoot me a note. And a reminder that through a week from today, $500 off your 10X admission. Just reach me directly. That's an offer for MDG premium paying subscribers.
Okay.
Thank you, everybody. Happy New Year. And reach me if you think you'll need some help with your marketing this year, because I'm planning out my year as well. Oh, wait a minute. Before we go, let's give it up for Brian Barrera, our newest author in the group with a bestseller on Amazon. Tell us about it.
Yeah, as I talked to you, Joe, it got slow, a little bit slow during the holidays. Everybody went on vacation and took breaks and shut their companies down. So I decided to make the most of my time. So I wrote a book. And yeah, I wrote it.
It's called?
What's that?
The book is called?
The book's called Your Ego, The Real Reason Your Business is Failing. It's literally going after people who say they want to do better with their business, with marketing, who are struggling in a recession. So I just used all my concepts and models that I've used, and I've also implemented into business strategies. And I just wrote a book about it. And yeah, it hit #1 new release on Amazon a couple times already. And I've gotten to number 24 on business leadership and number 24 on sports and entertainment, because it has some sports models in there as well. So yeah.
So if those who would like Brian to be our February 3rd speaker.
Sure.
I think you've just been, that's the way I get talent, just kind of peer pressure it.
That's fine. I love it.
All right. Thank you, everybody. Have a great week.
All right, take care, guys.
Bye-bye. Thank
Bye
you,
now.
Joe.